Today, I want to talk about some tips and tricks on how to better identify different forms of child maltreatment based off research suggests. So, when people ask how to respond or recognize child maltreatment, they're often looking for like a checklist. They want something simple, like if you see this one sign, abuse is happening and you should intervene. But the research is fairly clear in that there's almost never a single indicator that proves maltreatment. And so, what professionals and parents should really look for are patterns, the developmental context in which an injury and or abuse may be occurring, and whether what we see makes sense for the child in front of us. Now, let's start with physical injuries because our criminal justice system is obsessed with visible injuries, mostly because those are the often most visible signs that something is happening. The thing is, children are messy. They're running around, they got a lot of energy, and so they get hurt all the time. And bruises and bumps, it's just a normal part of childhood. The key question is not whether a child has an injury, but whether that injury matches what we know about child development. So, one of the most important concepts behind identifying physical abuse is mobility. Can the child move on their own? Medical research consistently shows that injury patterns change dramatically as children develop new physical abilities. This is why paying attention to certain ages becomes important for the investigative threshold. In fact, the medical research shows that accidental injuries are generally the most common, and they most commonly appear on bony areas such as the knees, the shins, the elbows, and foreheads in children who are mobile and active. So when a 5-year-old shows up with a bruised knee, that can make developmental sense. 5-year-olds are squirrely. Concern increases when the injuries appear in locations that children rarely injure on accident. And so what I've been taught and what is encouraged in the research is this concept of the 10-4 rule. 10-4 stands for bruising to the torso, ears, or neck in children under 4 years old, or any bruising on an infant younger than 4 months old. Research found that bruising in these areas, especially in non-mobile infants, is uncommon in accidental injuries and should prompt a closer evaluation. Babies who cannot crawl or walk do not generate impact injuries on their own. And so the reason 4 months matters is developmental. Most infants who are younger than 4 months are not yet rolling consistently, they're not crawling, and they're not pulling themselves into positions where they could injure themselves. And so pediatric studies often summarize this idea with a simple phrase: those who don't cruise rarely bruise. In other words, babies who can't move independently almost never develop accidental injuries. And so if you have someone that is saying, oh, the baby fell off the changing table, but this baby is 2 months old, that's not possible because the baby doesn't have enough strength to be able to roll off. And so when bruising appears in a non-mobile infant, professionals should really slow down and ask more questions because it's rare that there should be injuries in these places that could be explained developmentally or accidentally. The second threshold, age of 4 years or younger, relates to how children move and fall. So younger children tend to fall forward and strike bony areas, such as like their forehead, their chin, knees, and also their shins. As mobility increases, they get more squirrely. Accidental bruising becomes a lot more common, but it still should follow predictable patterns. Research shows that accidental injuries cluster on exposed surfaces of the body. The more bony, the more likely that we're going to see injuries that are accidental. Injuries on protected areas like the torso, the ears, neck, inner thighs, upper arms are less consistent with everyday play, especially when repeated. But even 10-4 is important to understand it's not a diagnostic tool, it's a screening tool. It helps professionals slow down and ask more questions and not to assume that an injury is solely related to abuse. Another area where research has changed professional practice involves explanations for injuries. One of the most important findings is that explanations often sound reasonable at first. Caregivers frequently describe short falls, rolling off the bed, slipping in the bathtub, or bumping into clumsy furniture. Those things absolutely happen, but medical research shows that short household falls rarely produce severe injuries in infants and young children. Studies examining witnessed short falls consistently find that serious head trauma, complex fractures, or even extensive internal injuries are really uncommon from low height falls. When the severity of the injury doesn't really align with the described mechanism of how it occurred, we don't want to immediately assume abuse, but instead we want to reassess whether the explanation fits the biomechanics and the developmental stage of the child. In addition to this, there are other several areas that have been supported by research to help professionals pay attention to determining whether this is accidental or something more malicious. One of the misconceptions that comes up a lot is the color of bruising. Many people believe you can determine when an injury happens based off color alone, and research does not support this. Studies show that bruise color varies widely depending on skin tone, lighting, healing differences, and the depth of injury. In fact, I published a study looking at the extent to which officers identified injuries on white versus victims with darker skin tones. And what we found was that the darker the skin tone, the less likely officers were able to identify injury. And that is because in darker skin tones, there is more melanin in the skin. And so that can cloud subcutaneous injuries, in other words, bruising. Statements like that bruise is 3 days old are not scientifically reliable. Professionals look at patterns and consistency, not necessarily the color timeliness. Where we would look at color timeliness is if we are seeing a pattern of bruising in different colors, because that is likely an indication that that person is continually being injured in the same spot multiple times because the stages are in different levels of healing. Additionally, accidental injuries tend to be much more irregular in shape. And so pattern injuries is where we need to be paying attention. So like loop marks, clear handprints, linear marks, something that has a sharp edge, those should raise concerns as they could indicate contact with an object rather than something like an accidental fall. And this is really important in terms of the kid saying that they fell, but it actually looks like a spatula hit them in the back. Injuries with clear edges or repeated spacing sometimes reflect belts, cords, or other tools. And the same can be said for burns on children. Accidental scalds tend to show up more as not having definitive edges and almost like splash marks. In addition to physical indicators, we also want to pay attention to behavioral indicators as well. Abuse can impact people to behave in different ways, and behavioral changes are often the first thing that teachers and caregivers notice. Sudden aggression, all of a sudden they're withdrawing, they are having trouble sleeping, their behavior is regressing, or it doesn't really seem like they are meeting developmental milestones. They seem very malnourished. They're fearful around certain individuals, or they're engaging in age inappropriate sexual behaviors. All of these things can be warning signs, but are not necessarily in and of themselves proof that abuse is occurring. Stress, bullying, grief, or even mental health challenges can also look like similar causes of those behavior. And so this is why professionals need to be looking for clusters of behaviors or changes over time rather than a single isolated symptom. A child who appears unusually fearful of a caregiver, or if they're expressing belief that the caregiver deserves to be killed or dead or becomes aggressive, those are maybe signs of chronic stress exposure. And research shows that children often model environments they experience. Additionally, why we shouldn't always rely on visible injuries, particularly in sexual assault cases, is that physical injuries aren't always obvious or they don't always show up. And is why behaviors and disclosure patterns become important in these cases. Indicators supporting the research include for sexual abuse behaviors that are potentially indicative of sexual abuse supported by the research include age inappropriate sexual knowledge. A 7-year-old should not have a STI. They should also not be describing semen as a milky white substance. And so that age is inappropriate to know that information. And so that should raise our red flags if a child is talking overly sexual and they haven't even gone through puberty and seem awfully young to be knowing the things that they know. Other research-based facts are sudden withdrawal of a specific individual, secrecy statements like saying they have a secret, but they can't really tell. But we see a lot of sexual abuse behavior in adolescents who are running away from home. Medical indicators of sexual abuse can include things like injuries in the genital area, recurrent UTIs, urinary infections, pain during urination. Also, if a child is pregnant, that shouldn't be a phrase, but if somebody who cannot legally consent to sex under 16 in Colorado is pregnant, it doesn't, unless the person is within the 4-year age gap, the Romeo and Juliet laws. But even then, people under 16 shouldn't be pregnant. I'm just saying, legally, children under the age of 16 shouldn't be pregnant, and we should be looking into that if they are. Particularly in sexual abuse cases, disclosure is rarely going to happen, if at all. And We cannot interview children the same way that we would interview a victim or an adult victim or an adult witness. We need to be asking open-ended questions that are developmentally appropriate because the research shows when we ask open-ended questions that aren't leading questions are bad because children tend to want to appease the person that they are talking to. And so if they believe that the person that they're talking to wants a yes answer, they'll just say yes, whether it's true or not. And so asking open-ended questions that allow them to explain their answer in their own ways has shown to be much more objective and actually accurate in terms of memory recall. Neglect looks a little bit different because it usually involves patterns rather than single events. So chronic hunger, untreated dental decay, like rotting teeth, not really having a lot of supervision, showing up in inappropriate clothes, like they're wearing a bunch of winter jackets in the summer, or they don't have a winter jacket in the winter. Persistent, like they are just a dirty kid. They constantly have bad hygiene, frequently unexplained school absences. Those can all signal a concern. But also understand that sometimes, especially in immigrant families, there may be a lot of absences from school because those kids are working. Doesn't necessarily mean that that is correct or right, but that's a cultural aspect in that sense. Or the family is relying on the younger teens to work in their mom and pop shop, things like that. So again, just these isolated behaviors aren't indicators of abuse. We want to be looking at patterns overall. And also, more importantly, poverty does not equate to neglect. The real key question is whether a child's needs continue to be unmet despite there being reasonable opportunities for care. Are the parents and or caregivers trying, maybe they don't have enough money for a formula, but are they reaching out to local nonprofits or church groups or things like that? And sometimes families just do not have the resources. They don't have the money to buy a new winter jacket. And so the winter jacket that they're wearing has holes in it. As long as there's evidence that the parents are trying to ensure that the needs of the children are met, that doesn't necessarily include neglect. We shouldn't be criminalizing people based off the lack of resources. And across all forms of maltreatment, the most important research takeaway is this. Individual signs are weak predictors. We need to be looking at patterns of physical signs and also the behavioral indicators over time. Those are much stronger indicators. And one thing that we constantly want to tell ourselves when we are confronted with a situation that could be potential abuse and or neglect is, how could this have happened accidentally? If a realistic, developmentally consistent explanation fits that evidence, that matters. But when injuries and the behaviors, the context in which they occur, we're getting different stories, it doesn't really seem plausible that this type of injury could occur, especially because it's on soft tissue versus the bony structures. Stories aren't aligning. The kid's constantly dirty. Now we're starting to see a pattern of behavior that we may want to look into. So the goal is to never diagnose abuse from observation alone. The goal is to recognize when concern rises enough that trained professionals should really take a closer look. And so the takeaway from this is simple but important. Signs and symptoms are signals, not conclusions. They help us notice when something might be wrong, but we always need to interpret them in context, and we want to be looking for patterns and behaviors over time. And then again, always trust your gut. It's better to report than to be sorry.